Hola, bona tarda a tots i a totes. En primer lloc, agrair-vos, donar-vos les gràcies per connectar-vos a aquest webinar, Transformació Digital en el sector sanitari alemany, que està dins del cicle de seminaris de presentació del nou servei Expansió Digital Health en Medtech. Recordar que aquest seminari està finançat per fons europeus a través del programa Enterprise Europe Network. Seguidament em presento, jo soc la Leire Alfonso, consultora sènior d'estratègia internacional, responsable del sector Salut i Ciències de la Vida. Com sabeu, el mercat de la salut i els equipaments mèdics al món ha augmentat en els últims 2 anys i es preveu que creixi encara més, la qual cosa ofereix un ampli ventall d'oportunitats de negoci per a les empreses del sector a Catalunya. En concret, a Alemanya s'està impulsant la transformació digital del sector sanitari i aquesta transició també obre una finestra d'oportunitat per als actors catalans que vulguin entrar al mercat sanitari alemany. En aquesta sessió comptarem amb la participació de la consultora Medical Valley Digital Health Application Center, consultora amb la que també ens acompanyarà durant el servei. El Medical Valley Digital Health Application Center té la seva seu a Baviera i és el resultat de la fusió, de la joint venture entre el Fraunhofer i el hub conegut com a Medical Valley de Nürnberg-Erlangen. De la mà del cap d'estratègia i innovació, el senyor Matthias Ras, ens explicaran la transformació digital del mercat alemany de salut i també participaran la Cordula Forsters, Health Economic Evaluation DIPA i Sophie Terheiden, Market Access Diga Process. Aquesta presentació serà en anglès i seguidament l'Alberto Martín, director de l'Oficina Exterior d'ACCIÓ a Alemanya, ens explicarà els detalls del nou servei Expansió Digital Health and Medtech. Finalment, obrirem un torn de preguntes per respondre a qualsevol dubte que us vagi sorgint. Abans d'introduir els primers ponents, us comento un parell de temes tècnics. Primer, que les presentacions les tindré publicades demà mateix en un enllaç que us estem posant ara mateix al xat. També informar-vos que la sessió s'està gravant i que aquesta gravació també serà publicada al mateix enllaç. Comentar-vos que totes les preguntes les podeu adreçar al xat de Q&A que teniu al Zoom a sota i us animo a que no us espereu al final, sinó que les aneu posant a mesura que us vagin sortint durant les presentacions. Sí que us recomano també que les preguntes que vagin dirigides als ponents que parlen anglès ja les feu directament en anglès i les que siguin més del servei, dirigides o bé a l'Albert o a mi, les podeu posar en castellà o en català. And now, just to start with the seminar, I pass the floor to our first speakers, Matthias Ras, Cordula Forsters, and Sophie Terheiden from Medical Valley Digital Health Application Center. Thank you very much for your collaboration. It's a pleasure to count with your participation in this webinar, and now the screen is yours.
All right, thank you. Can you see my screen?
Perfect.
All right. Thank you for the kind introduction. Welcome, everybody. We are pleased to cooperate with our colleagues from Catalonia and to have the opportunity to get to know more innovative companies from this region. Actually, we have already worked with partners from Catalonia quite a bit, and I was especially happy to see some familiar faces in the list of participants for today's event. My name is Matthias Ras. I have a background in information systems and strategic as well as innovation management. I have worked in R&D projects in different industries and in academia for some years, and now I'm head of strategy and innovation consulting at the DMAC. With me here today are my fantastic colleagues Cordula Forster and Sophie Terheiden. Cordula is a health economist, and before joining the DMAC, she has worked in research in the field of care. So besides her health economic expertise, she also has a strong focus on the increasingly important topic of digital care solutions, especially the so-called DIPA in Germany. Sophie is a social economist by training. She has worked for a manufacturer of digital healthcare solutions herself and has then changed sites to join the DMAC. to support manufacturers, especially with their DiGA projects. You might have heard of DiGA, Germany's pioneer model for the reimbursement of patient-centered digital health solutions. Of course, among other topics, you will learn more about DiGA and DiPA today. All right. This is the agenda for today. I will start with a brief introduction of the DMAC to give you an impression of who we are and what we do. Then Cordula will give you an overview on the German healthcare system and the different potential reimbursement pathways. And finally, Sophie will put the focus on DiGA and DiPA. We will close the session with an outlook on the next steps in this program. All right, now to the DMAC. We are part of the Medical Valley European Metropolitan Region in Nuremberg. This is a Medtech cluster that over time has evolved into an internationally leading innovation ecosystem in the field of healthcare. It was appointed by the federal government here in 2010 as the national top cluster for medical technology, and in 2017 as Germany's digital health hub. There are more than 500 medtech companies in this cluster, ranging from SMEs who are not familiar to the general public, but maybe market leaders in their segments, to big corporates like Siemens, who always had the Siemens healthcare headquarters here in the region. Now they are Siemens Healthineers, but they are still closely linked to Medical Valley. Actually, they are one of the founding partners of Medical Valley. We have more than 65 hospitals in this region, more than 80 university institutes with a focus on medtech. One key player in this region is the Friedrich-Alexander-Universität Erlangen-Nuremberg, with its long history of medical research and later medtech research. And FAU is also one of the founding partners of Medical Valley. There are more than 20 other research institutions with a focus on medtech in this region. For example, German research organization Fraunhofer, another one of our founding partners. They have their largest institute here in Erlangen, which is mostly known for the invention of the MP3 audio format some years ago. However, they also have a strong focus on medtech here. We operate 4 Medical Valley centers in the region that are home to medtech companies as well as researchers. These centers serve as incubators for startups, and they also facilitate close collaborations with researchers at the universities. There are many more organizations and activities that I could mention, but let's focus now on the DMAC. In 2018, we have founded the DMAC as a key unit in this ecosystem, right in the heart of this region. DMAC is the unit within this ecosystem that has a clear focus on everything digital health, especially patient-centered digital health solutions. We are a joint venture of Medical Valley EMN and the Fraunhofer Institute for Integrated Circuits, and we can build on both partners' complementary strength. The strength of Medical Valley, for sure, is the strong network at the national as well as the international level. And this network gives us access to different relevant players, medtech companies, pharmaceutical companies, insurers, care providers, investors, politicians, researchers, and so on. Fraunhofer, on the other hand, is our technology partner. The IIS is an application-oriented institute and a global leader in microelectronic and information technology system solutions, and we benefit from our joint research projects in the field of medtech, especially digital health. We at the DMAC combine the different competencies and are the digital health think tank as well as the digital health service provider in the Medical Valley family. Basically, DMAC is, well, 2 things. First, we work in research projects and aim to develop the digital health ecosystem of the future within this model region here. Second, DMAC is also a company that is offering specific services to other companies in the field of digital health, mainly digital health providers that want to enter the German healthcare market. And I guess that's why we are here today. Actually, this double role is quite helpful as our services are based on our research activities, which in turn benefit from our practical insights and our real world experience we get. We try to have a holistic view on healthcare at large, but also on specific healthcare solutions. So we cover and combine the medical, the technological, as well as the business perspective when we develop or evaluate healthcare solutions. And to have this holistic perspective, our core team is already very multidisciplinary. We have doctors, engineers, business experts, health economists, computer scientists here at the DMAC. And additionally, we would involve more experts from the Medical Valley ecosystem when they are needed. Later in the program, you will have the opportunity to meet, for example, Christian, our CTO for technological and regulatory aspects, Till, our head of clinical research for everything related to proof of evidence, or Sabine and Jochen, two doctors that bring in the medical and clinical perspective. We have two business areas, strategy and innovation and clinical research. In the area strategy innovation, we offer customized consulting services for digital healthcare providers and also proven innovation programs for startups. In the area clinical research, we offer different research services from conceptualization to implementation. So we basically act as a CRO, a clinical research organization specifically for digital healthcare solutions. So in the end, these two areas are not separate. We can support on the strategy and management side, but we do not leave our partners alone with concepts and plans. We also work very closely with our partners to implement these concepts and plans. Our services focus especially on market access and reimbursement, health economics, and proof of evidence. In market access and reimbursement, we provide knowledge on the German digital healthcare market to support manufacturers in developing and launching their products. We help to identify opportunities, understand requirements, overcome hurdles, and choose the most promising market access strategy and the best reimbursement pathway for each healthcare solution. In the field of health economics, we offer market and potential analysis to support business model development or the optimal market positioning and the communication with investors, for example. And our health economic evaluations can strengthen the manufacturer's argumentation, for example, in price negotiations, as well as the general communication towards payers, providers, users, and other stakeholders, of course. Yeah, proof of evidence. I've talked about proof of evidence already, and you will get a good impression, I think, from what Sophie will tell you in the part on DIGA and DIPA. Currently, and this is mainly demand-driven, I would say, our daily business focuses very strongly on DIGA. It's just a very interesting opportunity for companies, also from other countries. But Sophie will tell you more about this. It's similar with DIPA, but this topic is just starting right now. However, we are also ready to support here. And finally, apart from services for individual companies, we also organize startup programs that are based on proven concepts and are tailored to the cohort's specific requirements. They usually include teaching and mentoring and business development and access to our network, and aim to support startups in assessing well the potentials in the German digital healthcare market, exploring different opportunities and developing a market strategy. Sometimes we organize very large programs like this one ourselves, and sometimes we cooperate with partners for very specific programs for smaller cohorts, like it is the case with this program today. All right, now I would like to hand over to Cordula, who will give you a brief overview of the German healthcare system and the different reimbursement pathways.
Yes, thank you, Matthias. So I want to start now with a short overview of the German healthcare system. And can I already? Okay, now it works. So give you a short overview. Here you can see just a general structure of the market. Overall, Germany has about 83.2 million inhabitants and spends about 391 billion euros per year in the healthcare sector. So the healthcare sector in Germany is quite large, and that equals also about 11.7% of the overall GDP of Germany, and means also that Germany spends about 4,711 euros per person per year for healthcare services. And if we take a look at the healthcare sector in more detail, about 5.7 million people in Germany actually work in the healthcare sector. So that, I think it didn't really, okay. Sometimes a bit slow with moving forward in the slides. So about 5.7 million people work in the German healthcare sector. And so that is a huge provider of jobs here in Germany. And that you can see also because we have about 400,000 practicing doctors, about 1,900 hospitals, and also about 543,000 people working as nursing staff, for example. And now I want to give you a deeper insight on who is providing care in Germany. First of all, healthcare providers can be divided up into public, free, non-profit, and private organizations. And those three groups are quite equal in size. So they all play an important role. And the law in Germany divides healthcare providers then into several groups. And here you can see the most important ones. So firstly, there are the SHI accredited doctors whose services can be reimbursed by the statutory health insurance, and which often also have their own practices. They can either be general physicians or also specialists, such as neurologists, for example, or dentists. Then acute care and surgeries are mostly done in hospitals. And then there are also other professions providing care in the in or outpatient sector, such as therapists or midwives, giving care that is also mainly covered by the health insurance. If you need some aids for your illness, you can go to aid providers and get that there. And your medication, either the prescribed medication or over-the-counter drugs, is provided in pharmacies. Then there are also organizations that are responsible for patient transport, for example, the acute transport into hospitals. And they are mostly non-profit organizations, such as the ASB or the Red Cross. And the last big sector is the nursing staff. And the nursing staff can either work in hospitals, in nursing care homes, or in the ambulatory care. So after looking at the different professions, it is also important to know where the care is provided. For Germany, it is especially important to note that there is a strong separation between the inpatient and the outpatient sector. That means there are different payments for services, there are different reimbursement logics, there's a different access to care, and there's more or less no interaction between both of these sectors. And just as a side note, that is not only true for the medical care, but also in terms of nursing care, which can also either be provided ambulatory or in care homes. And to further understand the structure of the German healthcare system, you also need to ask yourself the question, who is paying for the service? So we already mentioned that there's a difference between the inpatient and the outpatient sector. And there's also a difference in the way you are insured. So in Germany, you can either be insured by the statutory or by a private health insurance. And about 90% of the population is insured by the SHI, the statutory health insurance. So SHI is also the biggest source of funding in Germany. And SHI is then followed by private households for out-of-pocket payments. And the third biggest funding source is social care insurance, and that covers basically all the nursing care sectors of SHI insured people. SHI and PHI also follow different payment logics. in SHI, there's the so-called principle of benefit in kind. That means that the patient is monthly fees to his SHI company, and then he can get services from that SHI company via a service catalog, by a physician or by another care provider, and then that physician gives his or her bill of the services he provided for the patient to the SHI company. So the SHI company directly reimburses the physician. And for the PHI, that works differently, because here the patient has to pay the physician directly after receiving the services. And then after that, he can send the invoice of the bill that he paid to the physician to his insurance, and the insurance company then reimburses the patient. But since about 88% of the German people are covered by the SHI, SHI plays the most important part for reimbursement pathways in Germany. And also there's not only one SHI company for all of the German people, but there are about 103 different SHI companies. And as an SHI insured person, you can freely choose which SHI company you want to have for yourself. And as you can see, they also vary a lot in size, with a range of 5,000 to 10.8 million people covered by a single SHI. And so now that you got a short overview of the German healthcare sector, I want to continue with the different reimbursement possibilities. So as you learned, the inpatient and the outpatient sectors are strictly divided in Germany, and so they also have different reimbursement logics. I want to start with the inpatient sector, and that has a dual reimbursement system. So first of all, there are investment costs, and they are covered by a special fund that is provided by the state government in charge. For example, the state government of Bavaria or Saxony. And running costs, on the other hand, are covered by the treatment of the patients. So by using a DRG system, that is basically the diagnosis-related groups reimbursement, that is disease-specific, and hospitals are reimbursed per hospital case, and then by the accumulated number of cases that they actually have per year. And for the inpatient sector, it is important to note that we have a so-called reservation of prohibition. That means that new treatment methods can be used and can also be covered by the health insurance as long as they are not explicitly prohibited. So that promotes innovation in the inpatient sector. And in addition to that, in 2020, the Hospital Future Law was passed, and that aims to further improve the digitalization of hospitals with a fund of 4.3 billion euros in total. And to motivate hospitals to actually invest that money, they will lose a part of their income in 2025 if they do not fulfill the then set stage of maturity of digitalization. And to get money from that fund, hospitals have to apply for the financial support at the Bundesamt für Soziale Sicherung, which is the national institution for social security. And hospitals can use that money for a variety of options. For example, for implementing electronic documentation of care and treatment services, but also for digital medication management, for automated clinical decision support systems, and several other options. Regarding the outpatient sector, reimbursement works differently. Outpatient services are listed in a catalog of services and prices that basically defines uniform standard prices for each service that is covered by the SHI. So in the outpatient sector, there is the so-called reservation of permission. That means that new treatment forms are not part of SHI service catalog and can therefore not be reimbursed by SHI companies as long as they are not approved by the Joint Federal Committee. So it works quite differently than in the inpatient sector. And the Joint Federal Committee, the GBA, examines whether a new treatment method is giving sufficient, appropriate, and also economical care for the insured, and also taking into account the current state of medical research. And to be covered by the SSI in the outpatient sector, you first have to find a way to get approved by the Joint Federal Committee, or to find a way to get into the service catalog. But especially for digital technologies, there's a huge variety of reimbursement options on how to get reimbursed by the SHI. And here I want to hand over to my colleague, Sophie Terheiden, to give you some insights on the different reimbursement pathways.
So, thank you. Yeah, but how to get reimbursed for Catalan manufacturers like you are in the German healthcare sector if you have a new idea or a new product? So which reimbursement pathways are there? And for new methods and product, there are several options, like Cordula already said, especially in the outpatient sector. In order to develop the right strategy for yourself, manufacturers should first ask themselves the following questions. I sum up a little bit. So in which sector should the product be used? Do you already have good contacts with health insurance companies, statutory health insurance, or private health insurance, or service providers? What type is your product? Is it aid? Is it a medical device? Which risk class do you have? Is it patient-centered? How much time may pass until your market access will happen? Is the market access planned to the entire SHI market, or should the market access start a little bit smaller? Like example, you want to collect a little bit more data about your product. And should the reimbursement be permanent? So which possibilities there are, I want to show you right now. Feel free to take the questions with you, and then we take a closer look at the possibilities in the German healthcare system, especially for digital healthcare solutions like you are. The possibilities can be divided into two groups. First, there are options to become part of the regular care, which means that after passing the requirements, your product will be reimbursed for all SHI insured persons. On the other hand, there are also options for special care, meaning that you can make selective contracts with individual SHI companies. This means that the product will be reimbursed only for people covered by that respective SHI company. Other SHI companies will not cover your product. There's a possibility if they join the contract. We will see that later on. This means that your target group will be smaller, but most of the time the regulations to be covered by a contract of special care can be fulfilled faster and easier. In addition, we want to show you or introduce to three possible ways to reimburse your digital health solution in more detail from both areas. We have the digital healthcare application, so-called DiGA, Matthias already mentioned. We have the digital care solution, the DiPA, that is coming with this year. And we have the contract of special care in Germany, also called besondere Versorgungsform. And with the last one, I want to start. the contract of special care. The aim is here to improve medical care, for example, intersectoral treatment pathways or integrated care. Therefore, you as manufacturer of a digital health product would partner with an SHI, sometimes also with medical associations to have a contract. Sorry, that was a little bit too fast. To have the contract living. The challenge here is that you mainly have regional contracts, like I already said. Then the contracts is all only for persons who are insured by this company, but could be benefit for all partners, because the SHI are interested in such contracts, because then they are more interested to the patients to get insured by them. Also for the doctors, that they have such new programs, and they mostly get some pricing for that or benefit for that. And you as manufacturer, that you have your product in real life, and also that you have more contractual freedom, and you have the possibility to collect data about your own product. Good to know. There are also agreements with collaborations of health insurance companies possible, because if you remember, Cordula says we have more than 100 health insurance companies in Germany at the moment. So if you want to have a contract like that, you have to have a contract or get in argumentation with all of them, but you can also go to collaborations. Here, for example, the GWQ, which we are working together with, who is representing more than 30 health insurance companies, so that this could be easier to have a more SHI reached. Yes, but now, or I want to give you an example, sorry. Maybe you know Tiny Tracks, they have such a contract of special care with the DRK, or the Barmer Health Insurance has a digital training program for back pain that is called Kaya. So two examples for that. Now I want to give you some insights about DiGA. I think it's probably the best known and most discussed refund option in Germany that we have right now. But how has DiGA begun? With the entry of the Digital Healthcare Act on the 19th December of 2019. We have the app on prescription for patient was introduced into the healthcare. This means that around 73 million insured persons in statutory health insurance are entitled to a supply of a DiGA, which can be described by doctors and psychotherapists, and is reimbursed by health insurance companies. So now you already see the big benefit of a DiGA. You will be reimbursed by all health insurance companies and not only by one or some of them. The prerequisite for this as that the DiGA, or you as manufacturer with your DiGA product, have successfully passed a test procedure at the BfArM and are listed in the DiGA directory of reimbursement digital health applications. DiGA directory is open, so if you want to have a look, just go Google DiGA directory. In this directory, you find essential information about the DiGA, and there you have also information for the doctors if he wants to prescribe this to his patient. The details of the procedure are regulated by the Supplementary Legal Ordinance of the Federal Ministry of Health, the Digital Health Applications Ordinance. This meant that applications could then be submitted to the BfArM from May 2020, and the first DiGA was listed in October 2020. And by now, it is so that we have today more than 100, or we have 120 25 applications at the B Farm to get listed in the B Farm directory, 32 applications for final listing, and 93 applications for provisional listing or preliminary listing. What is the difference? I will show you later. In the DIGA directory, we have today 31 applications. They are very mixed, but you can see it on the right side, which are listed in the DIGA directory. And we have applications for the indications like of the field of psychology, like example for depression and anxiety disorders, but also back pain, MS, and cancer. But how does the reimbursement for you as manufacturer works, and how does it work for the patient? Like I already say, it can be prescribed by a physician or by a psychologist, but, and this was new with the DIGA also in the German healthcare system, if the patient has the right indication, he can directly go to his health insurance company and can request this DIGA. Then the health insurance will check if everything is right with the patient record on their side, and then the health insurance company creates like an activation code and give it to the patient so that the patient can activate and confirmation of the app by entering the code. And if this happenings, you as manufacturer get reimbursed or get reimbursement for the activation code by the health insurance companies. This is the money flow by DIGA. But what has a DIGA have to be, or what isn't? The legislator has defined it as followed. The medical, or it must be a medical device of a low risk class, meaning 1 or 2A, MDR, sometimes if they are already some certified by MDD, it's also possible. The essential function must be based on digital technology. The purpose must to be support insurance persons or the patients. In addition, it also can support the doctor, but the main focus must be on the patient. The function must represent on one of the shown, and a diagnosis must already be available. This means that it must or cannot be primary prevention. Secondary prevention is okay, but not primary prevention, because there must be already an indication at the moment. An ICD-10 code must be given by doctors. In summary, you could say the DIGA is a digital helper in the patient's hand. So it was the first patient-centered product that is now reimbursed by law or by health insurance, but the laws say that the health insurance have to do that. The DIGA can be an app or a desktop application or a process solution. You can combine it with hardware or care services or other services and function, but you have to keep in mind that the digital function must always lead to the intended purpose and not one of the combined options. With the DIGA guide, however, the B Farm has extended the B Farm Bundesinstitution for Drugs and Medical Devices is very important for DIGA because they check the application. So this is a very good word to keep in mind. B Farm is the short form. And they has extend and elaborate the requirements of the legislature. And these consist of general requirements like data protection and data security, and especially, and this is something new, also interoperability. And on the other hand, the manufacturer has to show evidence for a positive care effect for the patient. This can be a medical benefit or a patient-relevant structural and procedural improvement. I will discuss it or go there a little bit deeper later on. You have to bring evidence, and the evaluation can be carried out by various methods, but RCT seems to be the gold standard. So the most DIGA manufacturers using RCTs. I would give you a short introduction to the general requirements as well as to the evidence for positive care effects, but we will have the workshop, more information by me or also by my colleagues on all of these topics. What is important for the requirements on the technical side is to keep in mind that we have in Germany the so-called Telematik Infrastruktur. The Telematik Infrastruktur is the kind of a secure internet, I would call it, that connects patient and doctors in the environment of the statutory health insurance companies, and only registered users or persons or institutions with an electronic health professional and practice card have access to. And it ensures cross-sectoral, cross-system and secure exchange of information. For example, we have here the electronic patient record, the e-medication plan, and like an safe email for doctors, and these are all provided by the Gematik. Gematik, please keep in mind, because they are responsible for everything related to the TI on behalf of the Federal Ministry of Health. And to get or to know that we have to sell safe network in Germany is not relevant only for DIGA manufacturers, also important for manufacturers who wants to offer, for example, patient information systems or other solutions that want to interact with the German healthcare system. And interoperability, as I already said, is a specific objective that the Federal Ministry of Health has for the German healthcare system, and therefore we have some special requirements for DIGA manufacturers. So you need interoperability of your DIGA. You need a human readable export so that the patient is, has or is the master of his own data. You need to have a connection in future to the electronic patient record through a machine readable export. The electronic patient record we have in Germany since the beginning of last year and is currently constantly being further developed. And interfaces for the devices, if you have some, must be interoperable as well, so that the patient can decide which device he wants to use or which he is used to. So he wants to use your DIGA also with this device if you are using a device. Here it is good to know that it is important that more and more uniform standards are sought here, and the so-called MIOs, that are fire-based information objects for the German healthcare system, are developed by the Gematik, like I already say. Christian Weigand, our CTO, will also be happy to give you more insights in the workshop. So this was my quick overview about the technical part, not my best part, but I hope you have an understanding. Then, like I already say, it is required that you bring proof of a positive care effect that your solution brings to the patient. And this is called the positive care effect in Germany. And it can be a medical benefit, like I already said, or a patient-relevant structural and procedural improvement in healthcare. One is enough to get listed in the DIGA directory. However, we will see that there will be more and more DIGAs and one indication, and therefore we as DMEC would say, okay, it would be better to have more. And you can prove them via the fast track study within 12 months. But what are the positive care effects? Like I said, medical benefit, or PSVV, we call it in short form. And the medical benefits is maybe known by you. They are well known from the pharmaceutical industry. We have the improvement of the state of health. We have the reduction of the duration of the disease, prolongation of survival. Okay, this is something we want to see because, like I already say, you have 12 months for a study, and we'll see it later on in the procedure. And this will be interesting to see whether some manufacturer can show a prolongation of survival within such a short study. And then we have improvement in the quality of life. These are well known, but with DIGA, like I said, there was new things for the whole German healthcare system, and also were these parts new. And so these 9 new benefits are also possible for you to show to the BfArM. And this could be coordination of the treatment procedures, alignment of treatment with guidelines and recognized standards, adherence, facilitating access to care, patient safety, health literacy, patient autonomy, coping with illness-related difficulties in everyday life, reduction of the therapy-related efforts, and strains for patients and their relatives. And now I will put the puzzle together, how this will work and why it is called the fast track procedure in Germany for DIGA to get listed in the DIGA directory, or how is the process looking. At the beginning, there is that you as manufacturer submits an application, and there you as manufacturer has to choose whether you will have already your proof of an PCOE, or you have to bring it via the fast track procedure. This is possible with this new procedure. With this possibility, you can hand in your application to the BfArM that examines your application within 3 months. And if you fulfill all requirements and have a hint, because also if you go into the preliminary admission, you have to bring therefore before systematic data evaluation of your own product that arguments why you can bring your positive care effect within 12 months, so that the study will go into the procedure of the DIGA fast track. That you have to hand in with your application. Sorry, I lost a little bit my line. Okay, we had that in course of a systematic data evaluation with its product in the indication that he can provide this proof in the context of a study with the help of an appropriate study design. So study design you have also to be in. And then the so-called fast track procedure makes it possible after the preliminary listing to bring your proof within the 12 months. So the procedure would be if you don't have enough evidence, or you don't have a study before, like most of the manufacturers we know have, hand in your application to the BfArM. Then there's a 3-month examination of the BfArM, and this is the fast track, I would say. And if the BfArM says, okay, you fulfill all requirements that we have, you will get the preliminary listing in the DIGA directory, and with the day one in the DIGA directory, you have 12 months time to bring plausible justification of a positive care effect. And after that, if you bring this within the 12 months, you hand in a report to the bee farm, and then you will get the final admission to the DIGA directory. Something special is that within the first 12 months that you can have your DIGA with your own price in the first year. Now there's the arbitration board updated the pricing of the DIGA. So we have some new rules for the pricing, but for higher or maximum prices and threshold values, depending on the indication and the positive supply effect you choose. But within these maximum prices, you can choose your own price. And after the 12 months and the okay for the final listing, you go to price negotiations with the GKV Spitzenverband. This is an association of all the health insurance companies, and with them you negotiate your final price. And then you will be listed forever and be in the DIGA directory. This is the procedure on the bee farm, but what does this mean for you as manufacturer? As a process, so in the ideation, when the ideation begins, you start with your DIGA or your app to make it DIGA app ready. You're starting then with the research part, where we as DMAC could support, or others, you start with the study protocol or the evaluation concept that you have to hand in. Also, if you go into the preliminary listing, then start this pre-study for the systematic data evaluation. Start with your bee farm application and the evaluation concept. Then you hand it into the bee farm. Via this, you can start preparing your study for the fast track. And when the bee farm says within after the 3 months it's okay, you go to the DIGA directory. Then the recruitment intervention evaluation would take place within these 12 months, so that after the 12 months you can hand in your proof of evidence to the bee farm and then start with your price negotiations. And on the whole time where you're already preliminary listed, you can sell your product as well. So this is the big benefit of the fast track procedure we have. This would be a short overview about DIGA and the DIGA process we have here with the bee farm in Germany. And I now would hand over to Cordula one more time to present the DIPA to you.
Yeah, thank you, Sophie. So about the DIPA. As an equivalent for the DIGA in 2021, Germany also wanted to launch the DIPA, and that is a digital care solution. And for that, we only want to give you a short insight, since there are still not all regulatory details clear, but we also think that it's still worth to mention, and we would also like to support you if you want to go the DIPA way. So with the Digital Healthcare and Nursing Care Modernization Act, Germany introduced the digital care solutions in 2021. And the final regulations, as I already mentioned, are not passed so far, but are estimated to be passed this summer. So some details are still unclear. But it is clear that DIPA will be reimbursed by the social care insurance, in contrast to the healthcare insurance for the DIGA. And DIPA address care receivers in the outpatient sector, in the ambulatory care sector. And in contrast to DIGA, they cannot be prescribed by a doctor, by a physician, or by a psychotherapist, but the cost coverage has to be applied for by the social care insurance. And also, just as DIGA, DIPA have to successfully pass a process by the BfArM and will then be listed in the so-called DIPA directory. So what is a DIPA specifically? In contrast to a DIPA does not have to be a medical device, but the main function still has to be based on a digital technology, just as with the DIGA. And for the DIPA, the existence of a care level, so the existence of a need of care is required to get it from the social care insurance. And the purpose for the DIPA is to reduce impairments of the independence or the abilities of the person in need of care, and also to prevent a worsening of the need of care. The DIPA are aimed directly at the person in need of care and have to be used by him, herself, and have to get a benefit for the person in need of care. The DIPA can also be used in interaction with relatives or ambulatory care facilities, but the focus has still to lie on the person in need of care. And it is also important to note that they can only be used in the ambulatory or home care setting and not, for example, in nursing care homes or in hospital settings. The general requirements are similar to the DIGA, but in contrast to the DIGA, DIPA do not have to prove a positive care effect, but show evidence of a so-called nursing benefit. And this could either be the management of special nursing situations or the organization or management of daily nursing routines. And the requirements for the level of evidence and for categories of the nursing benefit, what that could actually be, are still unclear though. But we can already give you an insight on the timeline of the admission process. So with the application to BfArM, you have to keep in mind that you already have to present evidence of fulfilling the general requirements and also the proof of a nursing benefit. So the preliminary listing, as Sophie already presented for the DIGA, is not possible here. And then BfArM has 3 months to decide if the DIPA will be admitted into the DIPA directory. And within 3 months after the admission, you will have to negotiate the amount of the reimbursement with the German National Association of Social Care Insurance Funds. That is also the equivalent to the GKV-Spitzenverband Sophie mentioned, but for the social insurance companies. And you also have to keep in mind and be aware that reimbursement for the DIPAs can only be up to 50 euros per month. And for more details on the definition of the nursing benefit, of the possible benefit categories, of the requirements for proof of nursing benefits, and for more details also on some specialties in the pricing, we are currently still waiting for the framework agreement to be published, but that is estimated to be published this summer so that we can then fully start also to go the DIPA way. And as a little summary, here you can see a short comparison of DIGA and DIPA. And as you may have noticed in their logic, both solutions are quite similar, but there are still some differences. So that the DIPA has to focus on supporting people in need of care, and DIGA has to focus on supporting people with their diseases, with coping with their illnesses. And that you can also see by the expected benefit, which is a nursing benefit for the DIPA and a positive care effect for the DIGA. They both are or will be listed in their own directory after they are approved by the BfArM. but the reimbursement works differently. So DIPA are financed by the social care insurance, where they have to be requested, and also you have to have a need of care. And DIGA are financed by the statutory health insurance and can also be directly requested by the SHI, or can also be prescribed by a physician with the requirement of an indication. And with that short overview, I would hand over to Matthias to give you a short wrap up of our presentation.
Before Matthias is handing over, I have to bring you, because I earn you one slide. I would give you, after Cordula had represented the comparison of both of them, I would give you the 10 learnings we have right now with the DIGA, because this is, I think, the most you're interested in. So DIGAs can achieve considerable prices. We have a price range from 119 to over 700 euros right now. The average price just over 400 euros. Our second learning is that high requirements, especially concerning the evidence, like I already said, RCT is established here as gold standard for the evaluation study. Or still, we have hesitant prescribers. At the last publication by the Association of the SHI, the GKV Spitzenverband, we had about 40,000 prescriptions in the first year of the DIGA, but they're still progressing, and we have more and more. Overall number of prescriptions still manageable, yet already considerable for single DIGA. Vivira and Calmeda are the top two ones. Vivira is about back pain and Calmeda is about tinnitus. And there we have for each of them over 8,000 prescription in the first year. So we have around 23 per day prescriptions for them. Our fifth learning is that manufacturers should deal with the proof of PCE at an early stage. Like I said, it's required that you bring the evidence, and it can already be helpful in the development of the functionality of your product to have these PCEs in mind. The time and the financial expenditure of the DIGA process should not be underestimated. Yes, it's called fast track procedure, but it seems a long and a time consuming process until you have all requirements fulfilled and the process within the 12 months. It is, but it should be noted that other refund methods can also be time consuming in their own way. If you remind that you want to have a special contract with one SHI, you need also have to discuss it with them, so it also can be time consuming. Then 7, structured and focused approach, as well as complexity reduction, mostly expanded in most cases. This is, like I showed you in the process, what does it mean for you as manufacturer? How should you do that? And 8, intensive exchange is necessary with the BfArM even after the application has been submitted. This is something that I missed before. So in the process, when you hand in your application for admission with the BfArM and they take 3 months, or they have 3 months for the examination, be aware that they will have questions to you. We sometimes call it the BfArM bingo or ping pong game, because you have to answer them very quick if they have questions to you. And 9 marketing and sales of DIGA should also be considered at an early stage. Remember, we have here no classical B2B or B2C market. This results in 2 target groups with the opportunity to increase this marketing via 2 channels. So doctors on the one hand and patients on the other side. And should be well prepared, because with the first day in the DIGA directory, we can be prescribed, and if you have, keep in mind, for your own price. So every day counts in the first year. And number 10, and this is something very important, DIGA has a potential success model, or is a potential success model for Europe. We don't know if you have recognized it. France has already introduced the law, and many other countries like Belgium, Luxembourg, and so on have indicated their interest to also have something like DIGA in their country. And these are our 10 learnings. More to that on the different points also in the workshop, where we would be happy to see you.
All right, that's it from our side. Basically, we just wanted to give a very brief outlook, as Leire and Alberto will provide you with more details on the program itself at the end of the session. So this is just from our perspective. However, one of the next steps in the program will be a workshop or a series of workshops in which we will pick up the main parts of today's webinar and we'll dig deeper into these topics. And for this, we will also include more details on technological and regulatory aspects, as well as on clinical aspects and proof of evidence. We will use the information we get from the participants, from the survey that our colleagues will send out to customize this workshop or this workshop series towards the participants' major interests and needs. And later in the program, we will have, or you will have, individual one-on-one coaching sessions with members from our team, from the team that you saw in the slides during our talk. And finally, towards the end of the program, we will support your business development. And for this, of course, we can build on the Medical Valley network that I have presented before. All right, that's it from our side, at least for now, because now I would like to hand over or back to Leire and Alberto, who will give you more details on the program. And of course, we stand ready to answer your questions at the end of the session.
Thank you, Matthias, Sophie, and Cordula for your presentation, which highlights the transformation of the healthcare market in Germany, and with very important tips for companies that would like to access the German market. We have already some questions and that we launch at the end of the seminar in the Q&A. I ara passem ja a presentar el servei Expansió Digital Health and Medtech, específic per al mercat d'Alemanya, de la mà del meu company, el director de l'oficina exterior d'ACCIÓ a Alemanya, l'Alberto Martín. Endavant, Alberto.
Moltes gràcies, Leire. And I also want to thank our colleagues from DMAC, Matthias, Sofia, and Cordula, for your collaboration within the framework of this program and for a very insightful presentation. As Leire just mentioned, I can see we already have quite a few questions. So I'm going to try to keep it short so that we have time to answer as many as possible at the end of the session. But anyways, we look forward to working together with you in supporting innovative Catalan companies in the field of the digital health sector in Germany. Ara el que voldria fer és repassar breument les característiques i les condicions d'aquest servei, així que compartiré pantalla. En aquests moments ens trobem, com podem veure en aquesta diapositiva resum, en la primera columna. Estem presentant les oportunitats dels 3 mercats que formen part d'aquest servei comú d'expansió salut digital i Medtech a Europa. Avui centrant-nos a Alemanya, demà al Regne Unit i demà passat a França. I per tant, en aquests moments queda oberta la convocatòria per tal que totes aquelles empreses interessades ens contacteu i ens comuniqueu el vostre interès en inscriure-us en aquest programa i el que aleshores farem serà enviar-vos un formulari que us demanarem que completeu fins al dia 22 d'abril i aquest formulari ens servirà per fer aquest procés de selecció competitiva. Competitiva perquè hi ha una sèrie de característiques que tindrem en compte, que de seguida explicarem, i també perquè hi ha un màxim de participants per cada mercat. Com podeu veure, esperem un mínim de 6 empreses i sobretot un màxim de 10 empreses per país. Així doncs, a finals d'abril tancarem la inscripció i al maig començarem pròpiament amb el programa per a aquelles empreses inscrites. El programa té 2 fases. La primera fase podríem dir que és més aviat analítica o teòrica. Comença al maig i té 3 grans punts. Un primer punt que seria el workshop, que ara comentava el nostre company de DIMAC. En funció també de les respostes que rebem en els formularis que ens enviareu, valorarem si té sentit fer només un workshop o més workshops. Haurem de veure si els interessos són molt homogenis o prou heterogenis com per fer diferents workshops centrats en temes diferents. Després d'aquests workshops tindrem reunions individuals amb cadascuna de les empreses. En aquestes reunions hi participarem tant el consultor especialitzat en salut digital de l'oficina com els nostres companys de la consultora DIMAC. I finalment tancarem aquesta primera fase amb un informe de recomanacions per entrar, en aquest cas, al mercat alemany. A partir d'aquí començarà la segona fase, que és més pràctica. Aquí el que farem serà oferir un suport en la identificació i en la presa de contacte amb els socis comercials, que poden ser des de clients directes, com ara hospitals o centres mèdics, distribuïdors, socis comercials, agents comercials, etc. I també valorarem si té sentit una possible participació en fires, com puguin ser la Fira Mèdica, que té lloc a Düsseldorf durant el mes de novembre, o en altres esdeveniments sectorials que també encaixin amb els vostres interessos. A qui va dirigit el servei? Evidentment, empreses del sector de la salut digital i de medical devices, però sobretot empreses que siguin, d'una banda, relativament madures, que ja estiguin preparades per poder entrar en el mercat alemany en aquest cas, i també que tinguin un component innovador. És a dir, volem empreses que tinguin una proposta de valor diferencial i que tinguin una experiència també prèvia en exportació, idealment a Europa, almenys en un mercat fora d'Espanya. També tindrem en compte el volum de negoci de les empreses. Suggerim que almenys sigui d'uns 100.000 euros la facturació mínima anual que tinguin les empreses participants, o almenys que sigui la facturació prevista per aquest any. I tot i així, encara que aquests són factors que tindrem en compte i que recomanem, valorarem totes les sol·licituds de les empreses interessades. Algunes altres consideracions importants sobre el servei són que no es podrà accedir directament a la fase 2 d'accés al mercat sense passar prèviament per la fase 1. Creiem que, donada la complexitat del sector de salut digital a Alemanya, és imprescindible aquesta primera fase de formació i d'assessorament personalitzat i especialitzat per cadascuna de les empreses. Per tant, serà necessari participar en la primera fase. No obstant, no necessàriament hauran de ser consecutives. Si bé hem dit que volem que les empreses ja estiguin preparades per poder accedir al mercat, pot ser que durant la primera fase constatem que són necessaris alguns canvis o adaptar alguns aspectes de la proposta de valor de l'empresa i que això no es pugui fer amb el temps tan curt que hi ha entre la primera i la segona fase. Per tant, en aquests casos també es pot plantejar fer un programa individual independent amb l'oficina exterior en funció de l'ocupació o simplement aplaçar la participació en la fase 2 a l'any següent i, per tant, tenir una mica més de temps per poder fer aquestes adaptacions necessàries. També vull subratllar que les oficines exteriors, en aquest cas la nostra oficina d'Alemanya, estarà implicada en totes les fases del servei. En el nostre cas comptem amb un consultor, en Robert Schmidt, especialitzat en el sector mèdic i el sector de la salut, que estarà present en totes aquestes reunions individuals i també en la tasca de fer la selecció de les empreses. I aquesta tasca és una tasca que farem conjuntament des d'ACCIÓ, amb els companys de Barcelona i l'oficina, però també amb la pròpia consultora DIMAC, que acaba de fer la presentació de l'ecosistema de salut digital alemany. Pel que fa a les condicions, els costos estan molt subvencionats per diferents raons. Primera, pel fet que ACCIÓ és una agència pública. En segon lloc, com ha explicat la Leire al començament, perquè comptem amb el suport d'Enterprise Europe Network, que també afegeix una bonificació addicional. I en tercer lloc, perquè en aquests moments les empreses poden beneficiar-se d'un descompte addicional del 67% degut a la delicada situació geopolítica que estem vivint. Això es tradueix en els preus que podem veure en la diapositiva. La primera fase tindria un cost de 156 euros i inclou aquestes hores d'assessorament en grup, en forma de workshops, com hem comentat, més l'assessorament individual que tindria lloc a través de les reunions. I la segona fase tindria un cost d'aproximadament 800 euros, que inclouria d'una banda un contingent de fins a 3,5 hores per part de la consultora partner d'IMAC per recolzar-nos en la selecció dels contactes d'interès per les empreses participants i fins a 80 hores en serveis de consultoria que oferiríem des de la pròpia oficina exterior. En aquests costos no estan inclosos les possibles despeses de viatge o d'organització en el cas que es decideixi que val la pena participar en algunes d'aquestes fires o esdeveniments que hem comentat abans. I ara, sense més, torno la paraula a la Leire perquè moderi la part de preguntes i respostes. Moltes gràcies i estem a disposició per qualsevol dubte que tingueu. Gràcies.
Moltes gràcies, Alberto. Ara anem al torn de preguntes. Tenim ja algunes al Q&A. Si voleu fer més, aquest és el moment. Intentarem respondre a totes les preguntes, sobretot a les que siguin més genèriques. Si hi ha alguna pregunta més específica, no us preocupeu que la respondrem per correu a posteriori de manera més particular durant els propers dies. Però anem a començar una miqueta amb el Q&A i hi ha moltes. There are some questions directly to DMAC. So, for example, in DIGA, does the reimbursement have to be per use of the digital solution? What if the license is annual per system, which no session limits?
Yeah, the logic in Germany usually is you get a prescription usually for a quarter or 3 months. And then you need a follow-up prescription. So payment is not exactly per use and it's not per year. In most cases, it's per 3 months. So these prices that Sophie has talked about refer to 3 months usually.
Okay, thank you, Matthias. Thank you for your answer. We have some more for you. Main difference between BfArM evaluation requirement and the EU MDR 2017-745 evaluated to obtain the CE mark. Alex told us that he sees redundancies between these requirements and take one for MDR regarding the positive impact, security, etc. Where can I find information completing? There is some document guidance on that.
Yeah, I'm not sure if I got the question right, but basically, yes, of course, there are similarities because the first main requirement you need, for example, to become a DIGA in Germany is also to have an approved medical device. So you already might fulfill most of these basic requirements that Sophie has talked about. And then on top of this, you have some additional requirements. You have to demonstrate these so-called positive care effects. So yes, for of course, the medical device certification is harmonized for Europe in general. So some of the requirements are redundant or the same, and you need some extra requirements for DIGA. There is a guideline on DIGA issued by the BfArM. You can just Google for DIGA guideline or DIGA Leitfaden is the German term, but there's also an English version. What is the English term they use, Sophie?
Guidance, I think. But keep in mind, the BfArM is not so open-minded. The English version is a little bit older. The newest requirements are only in German available. But if you want to understand the main requirements, you can go to the workshop. I think we will discuss it as well. But also within the English guidance. And yes, I would agree with Matthias.
Okay, we can share the link later on after the seminar with Aleix.
Sure.
More questions for you, Xavier. To what extent are domiciliary oral health services at care homes for the elderly covered by SHI, oral care at care home.
Yeah, so oral health services are always part of the SHI and not of the social care insurance. So they are covered as the same extent as for people living outside of care homes, and that are mostly prevention of illnesses in the mouth or loss of teeth. But there are also some extra services. I think if the care level is high enough, for example, the transport from the care home to the dentist will be covered by the SHI. And then there are also some additional prevention services for elderly people.
Okay, thank you. Thank you for your answer, Cordula. Main comments and explanations, Francesc says, are about apps on eHealth, but what about innovative Medtech devices?
I'm not sure if the question is towards DiGA again, but if you're talking DiGA, then you need to have a digital component, a significant digital component in your solution. But this does not necessarily mean that it's just an app on a smartphone.
Okay.
What's also possible is a desktop app, a classical desktop app on your computer, or it can also be an online platform. It's not necessarily just an app, but this app on prescription is just a symbol or something to easily explain what this DiGA thing is, because in most cases it is a mobile device app, I would say.
And in DiPA, medical devices are also included?
In DiPA?
Yeah, in DiPA, Cordula.
Yeah, it's basically the same logic as for the DiGA.
Okay.
So the same requirements for DiPA and for DiGA in that context.
So if you have a sensor or something like this that is working with your application, this is fine. Can be also a DiGA.
Can be
Okay,
a combination of hardware and software, yeah. And it can
perfect.
include other devices like sensors. Yeah.
Okay, I'll continue with the questions. Are increasing. Let me see. On DiGA, once a DiGA app is approved for use and listed, how is the app presented, marketed to physicians?
Yeah, that is a very good question, because of course this doesn't happen automatically, and this is what Sophie stressed in the 10 learnings on the 10 learning slide, because it's the first step, or it's one important step to get the DiGA into the directory. But then of course it's an equally important step to actually do marketing and sales for the DiGA, and this is of course something that the manufacturer has to do on its own, and this has to focus on two main target groups: those who can prescribe a DiGA, or the patients that might want to use it and can go to their insurance company and ask for this solution. So you have basically two main target groups that you need to convince. But yes, I mean your DiGA is listed in the catalog, in the DiGA registry. But that's it. No one is marketing it for you.
You
Yeah.
have to commercialize your solution in a way.
Yeah, this is, we knew or we see it a lot of times, that we have manufacturers that are startups or smaller companies, and the application for admission at the BFAM takes a lot of manpower and time. But at the same time, we would say, okay, prepare for marketing, get your product known. If you're indication specific, go to the specific doctors that they know. There are some rules in the German healthcare system that you have to follow if you go to the marketing. It's a so-called Heilmittelwerbegesetz that you have to follow if you're a medical device in Germany. But there's marketing possible, and you should do it, because like I said, with the first day in the directory, and you can be described, and you want that your doctors know you and don't say, okay, there's a patient and maybe I see there could be a DIGA, but I have to look it up in the DIGA directory. So marketing is a very important point.
Definitely we can help from the ACCIÓ office in Berlin, in Alemanya, Alberto.
And for marketing, yes, you should use also your networks and professional organizations that might give you access to the relevant groups. And as Sophie said, doctors are very important in this process. And what really convinces doctors usually is evidence. So if you demonstrate evidence in your studies, this is not something you need to do for the registration of your DIGA, but also something that helps you in the argumentation or communication with doctors, because this is why some prescribers still are hesitant, because they first want to see the evidence for these solutions that have rather high prices. So yes, think about your target groups and the stakeholders that can influence marketing and sales somehow.
Yeah, very interesting. Eduardo asks us if you are able to share 2 or 3 examples of DIGA software already approved, I guess.
Sorry, can you repeat the question, Leila?
If you can share 2 or 3 examples of DIGA software already approved.
We have, like I said, the two stars or with the most prescriptions are Calmeda, that is a DIGA for tinnitus. And we have also Vivira, it is called. They are for back pain. But we have like DIGA Somnio, which is for better sleeping if you have insomnia. And more over the most, we have like Hello Better or Selfie with a background of psychologists for depression. This would be some examples we can give you that are already in the DIGA directory and listed. Also Zanadio, to have another indication that helps for adipositas. So they're more have an interventional character.
Okay, thank you, Sophie. And talking about evidence, Matthias, Jordi asks us if for evidences, some success stories or cases in Catalonia can be accepted.
Yeah, it depends. The BfArM loves studies in Germany. So usually the standard is they want to see clinical studies that are done in Germany. If you can demonstrate that the healthcare system and the population and everything is similar, comparable, then it theoretically is possible to use clinical studies from other countries. In any case, these studies that you might have done already can help with the first step in the application process with the pre-study. And maybe then for the main study in the process, you will need another study in Germany, but this is very individual. Theoretically, you can use studies from other countries, but there are some criteria that need to be fulfilled. With countries in Europe, of course, chances are better than, for example, with studies that have been conducted in the US or Asia or somewhere else, but the healthcare system is very different.
Okay.
Yeah, I think there we have to hope that the other European countries will also go the DIGA way. And therefore, I think then it will be more possible to use studies from other countries as well.
Yeah,
That's the moment we have at the moment that Germany, that we are at this point the first ones in this digitalization part, and therefore the BfArM is very, very located. But we had the discussion also with Catalan startups as well, how we can argument for use it for the pre-study.
And that's also
any other comments, Matthias, Cordula, Sophie?
I just want to add that this is basically something that Sophie has addressed when she said DIGAs could be a potential success model for Europe, because we already have this harmonization on the technological side a little bit. We have MDR and we have GDPR that is for whole Europe. And of course, a European DIGA would harmonize also the clinical side of these things. And once this happens, then of course, it will be easier to include studies from different countries.
Yeah, definitely. Well, now we have some questions related to the service. I change into Catalan, if you don't mind.
Later, maybe before doing that, I think we just received a question in German from Monica Gutierrez Gonzalo, which is addressed to our colleagues from DMAC. So I'm going to try to translate it into English.
Perfect, Alberto. Thank you for your help.
No worries. So basically the question is, she mentions they are a Catalan startup based in Düsseldorf, and they're having some issues, some difficulties when trying to reach out to German hospitals in order to present their health app. So the question is whether you have direct contact to the management of hospitals and specifically to children's hospitals.
Yeah, we have some contacts to hospitals, of course, via the Medical Valley Mother Organization. I have to say that it's not our core expertise to support sales for companies that want to approach partners for sales of their digital health solutions. Of course, we can support or will support business development in this program, but for just supporting sales activities, we at the DMAC would not be the right people. That it could be our mother organization, Medical Valley. So just write us an email and we see what we can do.
Thanks, Matthias, and back to you later.
Yes, now regarding our service itself, nos pregunta Cristian si para startups fundadas fuera de Cataluña pero con oficina en Barcelona es posible participar. En principio nosotros trabajamos en un ámbito de actuación de Cataluña, pero efectivamente empresas que tengan operativa en Cataluña podrían participar, lo podemos ver en particular. Cristian, nos envías un correo y lo hablamos. También nos pregunta Melqui, hola, si además de SMEs, empresas pequeñas también pueden participar large companies, y por supuesto que sí, está abierto a todo tipo de empresas y como ha dicho Alberto anteriormente, evaluaremos todas las solicitudes. Yo creo que esto ya, por aquí ya tenemos todas las preguntas contestadas, así que vamos un poco tarde de tiempo, así que dono por tancada el top de preguntas i recordar algunes coses. Les presentacions i la gravació de la sessió les tindré publicades entre avui i demà al xat, que ja us hem, a l'enllaç que ja us hem posat al xat. Aquí teniu l'enllaç directe on podeu trobar la presentació i les gravacions. En segon lloc, convidar-vos o animar-vos a inscriure-vos a les sessions específiques per UK i per França, que també teniu els enllaços directes al xat. La convocatòria per a Alemanya, com deia l'Alberto, ja està oberta des d'avui mateix. Serà una selecció competitiva, us animem a inscriure-vos i, sobretot, inscripcions fins al 22 d'abril, molt important. I si teniu qualsevol dubte, em podeu contactar directament. Teniu també les meves dades de contacte al xat. Només em queda, Alberto, no sé si vols afegir alguna paraula, algun comentari.
No, simplement animar-vos a inscriure-vos. Creiem que és una oportunitat realment única. També recordar-vos que podeu inscriure-us paral·lelament o simultàniament en més d'un mercat. Per tant, estigueu atents als seminaris de demà i demà passat de Regne Unit i França per valorar quins us encaixen millor i esperem rebre les vostres sol·licituds.
Voldríem acabar donant les gràcies per la seva participació als ponents. Matthias, Cordula, Sophie, thank you very much for your collaboration with us. Gràcies també a totes les entitats col·laboradores, a FENIN, Biocat, a Catalonia Bio, al clúster de salut mental i el Barcelona Health Hub. a Enterprise Europe Network, que financia aquest seminari, i a tots vosaltres per estar connectats avui o veure aquest webinar en diferit. Confiem en que aquest nou servei sigui del vostre interès i esperem veure-us a les properes sessions. Moltes gràcies i fins aviat.